the next topic in this chapter is drug resistance. First of all, what is the meaning of drug resistance? Drug resistance is the phenomena where the pathogens against which certain medicines are supposed to work, they are not able to work against these pathogens anymore. That is, the pathogens have become resistant to these drugs. So even if you take the medication against this particular pathogen, you will still not see any problem. Meaning that even if you take a medicine against a certain pathogen, this medicine is not working. And because this medicine is not working, you are not able to relieve yourself of that particular disease. So this is a phenomena which is called as drug resistance. Now, drug resistance has started to become a major problem in the entire world. We have seen that there have been many instances of different diseases where the pathogens have started to become resistant against a certain medicine or a certain drug. Now, when we talk about such a scenario, there are many ways in which it can happen. There are many causes behind something like this to happen. And we'll have a discussion on all these causes and what are the steps that we need to take to make sure that drug resistance does not become a menace. So first of all, drug resistance is the reduction in effectiveness of medication, right? So medication or the drug that is being taken against a particular pathogen, this medication is not working anymore. It is not effective anymore. So this is the condition where we'll say that the particular pathogen has become drug resistant. So when an organism is resistant to more than one drug, it is said to be multi-drug resistant. All right. So we had taken, if you remember, we had taken an example called as MDR-TB. Correct? We had taken the example of MDR-TB. So MDR-TB, we had discussed that it is multiple drug resistant tuberculosis, where you have a particular kind of tuberculosis where the normal medication and more than one kind of medication is not working against the pathogen. So that is the scenario which we called as MDR-TB or multiple drug resistant TB. So there are cases where we see that a pathogen starts to become resistant towards multiple different medication that used to work against them. So this is the condition where we say that it has become multiple drug resistant variant. Now, drug resistance could be of many forms. For example, it can be antibiotic resistance. It can be antibacterial resistance. It can be antiviral resistance. So there are multiple forms of drug resistance depending on what kind of medicine are we talking about against which a resistance has been built in the pathogen. So depending on that, you can call it as antiviral or antibacterial or antibiotic resistance as well. Now let's try to understand the mechanism behind drug resistance and how can drug resistance spread from one person to another, or it can become a big challenge. If you go back to 2015-16, something similar to how COVID started to spread had happened. That there was one instance of drug resistance in one of the bacteria that was isolated back in, I think, October or November of 2015, again in China. From there on, I think by February or March of 2016, there were at least 35 countries where we had seen this particular drug resistance strain. So now just imagine that within 4-5 months, even the drug resistance as a property had started to move around the world. In India, for the first time, it was March 2016 that particular strain of drug resistant bacteria was seen in India. And this basically was drug resistance against a last mile drug called as colistin. Colistin, which is a last mile drug. Now we'll try to understand what is last mile drug as well in the coming part of the lecture. We'll discuss that. But we had seen drug resistance against colistin in a strain of bacteria. So what we have seen is that once drug resistance starts to build up in any of the pathogens, it starts to spread also very quickly. So what happens is, let's say in a person, first there will be just a couple of drug resistant bacteria. From there on, let's say when you are eating the medicine, when you are taking the medicine, after taking the medicine, all the other normal bacteria would be killed, but the ones which are resistant against this particular medicine, they will not die. They will live on. Now, what happens is that these bacteria now multiply. So instead of you having the normal bacteria and only a couple of drug resistant bacteria, now you have only the drug resistant bacteria. And even if there were a few of the non-drug resistant bacteria in the gut, even they will be converted. With mutation, even they will convert into drug resistant bacteria. So in this manner, now the bacteria that is there in the gut of a person, this bacteria is drug resistant, or rather all the bacteria which are there or of a particular bacteria type, they will be drug resistant. So this is how we see that drug resistance starts to build up. Now there are many factors which are behind building up of this drug resistance. Let's try to understand that. Now the first reason for drug resistance to build up in a given person could be improper antibiotic consumption. Now what happens is, in general, I'm talking about this, maybe you are not that person, but many a times what we see is that we start to become our own doctors. You see a headache, if you have a headache, go take a crocin, go take Saridon or whatever you have. Maybe take paracetamol if you feel that the headache is very severe. But we don't try to understand what the root cause of that headache would be, or how safe or unsafe taking an unprescribed medicine could be. And this is how we try to treat ourselves by our own hands without taking consultation from any doctor. In case of antibiotics, this can be a major problem. Let's say you have some kind of symptom of a particular disease. When you go to the doctor asks you to take a certain medicine 2 times a day, one in the morning, one in the evening for 5 days. Now by the second day or maybe by the third morning, you feel much better. You feel that now the fever is gone or any other symptom that you had is gone. So I perhaps don't need to take the medicine anymore. So you stop the third day. You stop taking the medication the third day, although you were prescribed to go through the medication for at least 5 days. What happens next? The pathogen which was there inside your body, most of them would have been killed. That's why the symptom does not show anymore. But chances are very high that some of the pathogens have not died. Some pathogens still live on. And now what happens is that these pathogens will start to multiply. And these pathogens, they have already seen what could kill them, or what killed their brothers, or the other pathogens which were there in your body. Now, they will start to become resistant. They will start to become stronger against this particular medication. And if this is a repeated behavior of yours, then chances are very high that after a point in time, the bacteria or any pathogen for that matter which was there inside your body, they now start to become drug resistant. So now you will have to take more medication. You will see that these symptoms are not going away as quickly as they used to be. So all these kind of build-up will start to happen. So one of the ways in which drug resistance can build up is when you don't take your antibiotics as prescribed. Either you take more than what was required or you take less than what was required. Both the cases are equally harmful. So that's why prescription has to be followed. The doctor is a doctor because they have taken a degree and they have at least studied for 5 years before understanding what the diseases are and how to prescribe a medication for it. If you are from non-medical background, I'm sorry to say you do not have that qualification. So only having a fever and taking paracetamol for that fever all the time may not work out for you. So that's why you have to take these kind of precautions. So one way could be improper medication. Improper medication. And this could be on both the sides. It could either be more than what was required or it could also be less than what was required. Alright? Either more or less than required. Than the required. So in both the cases, improper medication can be harmful. Then after that, let's say this person, we are talking about this person who was not taking medication as prescribed, and what happens is that drug resistant bacteria, start to build up inside the body of this particular person. Now this person goes to a medical care facility or a hospital. Now what happens in the hospital is that there are other patients who are not that immune, whose immune system is down because they have some disease or the other. Correct? So because of this, what will happen is that these resistant bacteria, they will also go and start infecting other patients in the hospital. So now what happens is that it starts to spread. So first it spreads to the patients, and then it also spreads to the patients, and then it also spreads to the doctors and nurses who are working at that hospital. Although they will not get a disease. Remember that this is not a disease, but just that the bacteria now are a part of your system. They have entered your body and they perhaps will start to mutate other bacteria if similar bacteria are there in the body. So although they are not causing any disease as such, it's not that this is an infection or this is a disease, but it's just a drug resistant pathogen. So they starts to spread to the healthcare providers as well. Now what happens is that these doctors will meet more patients, correct? These doctors will meet more patients, and then in that case it will start to spread to other people as well. So in this manner, one person who did not take proper medication would actually become the reason for drug resistance to start spreading all across to many people across the term. So this is something that can happen. So this is one route. All right, this is one route that can be taken by the drug resistant bacteria, improper medication. The second could also come from animals. Now in our case, we are still very considerate that instead of taking maybe 10 pills, we are taking probably 12 pills or 15 pills, but not going beyond that. But when it comes to the animals, we actually do not consider this much. We simply think that, okay, antibiotics have to be given to the animals. Instead of one tablet, let's give 4 tablets so that they'll just be safe or they will be out of danger of any disease. We do not consider how impactful this medicine could be in a negative manner, because from here also the drug resistance can build up. That these animals, livestock or cattle, they may start to build drug resistance, or the bacteria inside their gut may start to build drug resistance. Now what happens is that these animals, these cattle or livestock, they have drug resistant bacteria in their gut, either through their fecal matter, or if let's say they are being eaten and the food is not very well cooked, the meat is not very well cooked. So in this case what happens is that because the food is not well cooked, the meat is not well cooked, the bacteria perhaps they are still living, and now when you eat them, these bacteria enter the body of the people or the humans. The second way that these animals can become the sources or can become the vectors for these bacteria to be passed on to the humans could be through fecal matter. That these fecal matter, let's say they are spread in the farms or in the agricultural fields, or maybe they mix with the water bodies, and then these bacteria also go to these water bodies, or they also become a part of the entire ecosystem as such. So this becomes another route. This is another route that can be taken by the drug resistant bacteria to enter the food chain and enter the humans as well. So the second way could be through livestock. Correct? Here also what happens is either through their meat or through their fecal matter. Correct? These are two ways in which the livestock can also contribute to drug resistance. So drug resistance bacteria on the meat and not properly cooked food eaten by the humans means that it again enters the population. Then after that, another way could be that through fertilizers or the fecal matter, also this may start to enter the food chain and it can become a part of it can enter the human population. Now there is another way. There is another way in which this drug resistance can build up. One is definitely about medication, either taking more or less than required, or also, I would add another point, also taking wrong medication. Taking wrong medication. So one is that you are taking the correct medication but not in the prescribed dosage. Second way could be that you are taking wrong medicine. That, as I gave you the example, that for any fever you feel that paracetamol would work. But fever could have happened due to many things. We have seen so many symptoms of so many communicable diseases where every time fever is one of the symptoms. Correct? So that's why you don't know why the fever happened. You may not know why the fever happened and you are taking the wrong medication. So wrong medication can also become one of the reasons why drug resistance can start to build up in the pathogen. The third way could be through improper biomedical waste disposal. Now, what happens is, let's say, when you talk about manufacturing of a drug or manufacturing of a medicine, from there on also a lot of waste material will be generated, and all these waste, they go through the drains or something, or some discharge. Correct? Now they also go and mix with the water body. Now, if let's say there are residues of medicines or residues of drugs in these waste discharges, the same medicines will again go and mix with the water bodies. Now, in all these water bodies, in the drainage system, etc., you have a lot of pathogens. You have a lot of bacteria, viruses, etc. So, what happens then? These bacteria are very frequently coming in contact with the waste material coming from the drug industries or manufacturing unit. So now in the drainage system itself, they start to develop a resistance. They start to develop a resistance against these medicines. So unknowingly, there is another way in which we are building drug resistance in the pathogen. And that is through improper biomedical waste disposal, basically through from the drug manufacturing units. So this is another way in which drug resistance can start to spread. So that's why you have to remember that there are so many ways or so many pathways that can be taken by the pathogen to enter the human body and become a menace and start spreading drug resistance. Now, when drug resistance starts to develop, you have to understand that this becomes a very difficult scenario to handle, because now you are saying that the medication will not work. The medication that was supposed to work against a certain disease, a certain pathogen, is not going to work anymore. What are you going to do next? You probably will be looking for replacements. You'll be looking for new kind of drugs which perhaps will work against this drug resistant bacteria or any pathogen for that matter. But by the time you build it, it perhaps will take you another 6 months or another 1 year of time. What do you do till then? What happens to the patients until that point of time? So they are highly susceptible then to being completely exposed to these pathogens. So that's why we have to ensure that we take all the precautions ensuring that drug resistance does not build up. Otherwise, it takes a very small amount of time for drug resistance to build up. And we have seen, for example, the example that we took for what happened, what started from China and spread to more than 35 countries within 3 months of time. And if there are patients who are suffering from a similar pathogen, they will not be treated anymore. They cannot be treated anymore with the help of these drugs. So that's why this can become a menace, and we have to make sure that it does not. So what are the steps that can be taken to combat antimicrobial resistance or antibacterial or antiviral or antibiotic resistance? There is this campaign run by the government of India which is called as the Red Line campaign. So what the ministry is doing through Red Line campaign is that this kind of a red line, as you can see in the picture, this kind of red line will be seen in many of the medicines. And if you see any medicine, any tablet which has this red line, it simply means that they should not be taken without prescription. You have to make sure that unless it has been prescribed by a doctor, you cannot take this kind of a medicine, because this is a medicine which can very easily lead to drug resistance. Because these are, most of the times, these are drugs which are last mile drugs or very high dosage drug or very potent drugs. So that's why it has to be taken with precaution only when required, including antibiotics without a doctor's prescription. These medicines are called as medicines with the red line. These are called as medicines with the red line. So if there is a red line like this, then it means that unless it has been prescribed by a doctor, it should not be taken. So the campaign is aimed at discouraging unnecessary prescription and over-the-counter sale of antibiotics, causing drug resistance for several critical diseases including TB, malaria, urinary tract infections, and even HIV. Please cut this slide. This slide is not required. Then apart from running the red line campaign, there is something else that needs to be done, and this is something that has to be done even at community level. Not only as a part of policy or a program, but also at community level this has to be done. To, for example, encourage the appropriate and informed healthcare seeking behavior among citizens. That people need to understand that when do you take a medicine, what medicine you should take when required. Because let's say, for example, even in case of a normal disease, many a times we can take a very high dosage of a medicine. So that is something that completely should be avoided. Because once your body develops a habit that every time there is even a minor complication, you will take a medicine, your body starts to not function naturally. Your immune system will not function as quickly as it should normally. So all these things will start to happen. So that's why prescription and knowing about the disease, knowing about what drug to take, when to take it, and what are the dosages in which they have to be taken, all these things, all these knowledge become very, very important. Then after that, educate patients and general community on one, dangers of taking antibiotics without being prescribed, and containment for antimicrobial resistance. That what needs to be done and how do we contain if in case we have seen these kind of cases. And then also prescription audit has to be done to minimize the overuse or misuse of drugs. So many a times, let's say the doctors have not prescribed it, but you go to a medical counter or you go to a pharmaceutical shop and they only suggest you, okay, this is the symptom, take this medicine. So all those kind of things also have to be avoided, and there has to be a proper audit against these things. Now after that, there is one step that was taken by the WHO, and this was the revision of antibiotic protocol. So what WHO has done is that all the medicines, all the antibiotics that are available, they have been categorized into three different categories: access, watch, and reserve. Access category is all the commonly used antibiotics which are okay to use, which will not cause further complications, which may not lead to any kind of antimicrobial resistance. Then after that comes the watch category, which is slightly more potent drug, and that's why they should be taken with caution. And then comes the reserve category. Reserve category is the potent drug that has to be used only as a last resort, and this is a kind of drug which is called as a last mile drug. Now what is the meaning of last mile drug? Last mile drug or last resort drug is the kind of medication that you should take only if all the other medicines are not working. Any other drug is not working, is not able to treat that particular disease, so then only you have to use the last mile drug. If such a situation has not come, then last mile drug have to be thoroughly avoided. And that's why it has been placed in the reserve category. That first of all, these last mile drugs have a lot of side effects. So you cannot take it in large dose. At the same time, because they are very potent, they can induce drug resistance in the pathogen. So that's why they have to be avoided. Now, the problem that we discussed about the colistin problem, colistin basically is a last mile drug. Colistin is a last mile drug. So that's why the drug resistance that we had seen building up in China, which spread to other parts of the world, including India, this was resistance against colistin. Now just imagine, colistin has to be taken only if the normal drug is not working. And in this case, even colistin is not going to work. What do you do next? These all medications, it means simply that it is not working. So now, this individual, or if we have a patient who already has this drug resistant bacteria in their gut, then in that case, these medications will not help them anymore. And if this is fatal for them, they perhaps cannot be saved. So this is the kind of problem that can develop. That even if a last mile drug is not working and we have seen antimicrobial resistance developing against a last mile drug, then after that there is nothing else that can work. Of course, we will be able to build another drug or another medicine which is similar and which is going to work against the diseases or the pathogens in future, but by that time you do that, it perhaps would have taken 6 months or 1 year of time. And that's why until then everyone is vulnerable to these particular pathogens. So that's why all these steps and everything become very, very important. And that's why this revision of antibiotic protocol has been a very important step by the WHO. So what is the purpose? The new WHO list should help the health system planners and prescribers to ensure that people who need antibiotics have access to them and ensure that they get the right one, so that problem of resistance does not get worse. And at the same time it will also help all the prescribers or all the pharmaceutical shops etc as well, because now they have a guideline and they know that they have to follow the particular guideline. So it will help the governments also to bring in policies in place, programs in place, and also educate everyone who is associated with this particular field. So this is something that will be very, very helpful. With this we come to the end of this particular topic as well. Very, very important topic. One question had come back in 2014 in the mains examination. Apart from that, there are always chances that a question can come from here, because this is a topic that is not an old topic anymore. This is something that has become a part of discussion all over the world. So that's why this is an important topic both from your prelims as well as from your mains perspective.